So welcome, one and all, to a topic that is near and dear to my heart. I hope that you guys are in this time of turbulent times, COVID-19, that you are safe and doing everything humanly possible to continue to be that way, because this COVID-19 is a deadly disease, and it is affecting people of color greater than any other culture there is out there. So thank you for joining us. We're going to go ahead and get started with this presentation. Thanks to the Coalition for Health Equity for sponsoring this. And again, I'm Dr. Norwood, and you've heard my presentation. So what is COVID-19? We've all heard about it. It is a severe acute respiratory syndrome coronavirus, spread from person to person. And we can't forget about that. It is spread from person to person, infected persons, and it is you become infected by coming in contact with someone who is infected, and you just when you by just talking, by shaking hands, by being close to that person, it's important that you keep your distance, okay? Because you can become infected, because those respiratory droplets, when they're talking to you, those respiratory droplets that someone has sneezed or coughed, and you put your hands down on where they sneezed or coughed, you can become infected. So you just have to be very, very careful about what you're doing. And then a lot of times, because we always use our hands for a lot of things, and the first thing that when we get excited, we touch our face. When we're talking to someone and someone says something that you just really can't believe, you touch your face. You have to keep in mind that you can't really touch your face during these times, okay? And so touching your face, your mouth, your nose, your eyes, you can get infected by it, okay? So is this real? Yes, it is very real indeed. And so you say, so what symptoms do I need, or if I have these symptoms, what do I have it? So COVID-19 affects different people in different ways. Infected people have had a wide range of symptoms, and you can see these symptoms. You got fever or chills. You have cough, shortness of breath or difficulty breathing, fatigue, headaches. This loss of taste or smell. I've known several people that personally, that the way they found out that they had it, they didn't have no other symptoms, but they lost their sense of taste or smell. It's like, oh, I can't taste my food anymore. And sure enough, they went and got tested, and they were positive, okay? Congestion or runny nose, nausea, vomiting, or diarrhea, these are all symptoms. Now, these all sounds like symptoms of the flu. They are, and come this month, starting this month, it's gonna be very, very difficult to distinguish between COVID-19 and the influenza virus. So we're gonna have to be very diligent in making sure that we protect ourselves. Symptoms may appear between 2 to 14 days after exposure. So you get exposed, you don't know you're exposed, and you're going out, so you're asymptomatic, and all of a sudden you start coming with these symptoms, okay? So red flags that we say that is very important. These are the symptoms that you need to really concentrate on in getting emergency help. Trouble breathing. I can't breathe because I'm so congested in my chest. I'm having a hard time trying to breathe. Persistent pain or pressure in your chest. You may feel like you're having a heart attack. It's just really tightness in your chest that you're gonna need to seek medical attention. You get confused, don't know where you are, you can't remember things. Things don't seem to appear the way they're supposed to be appearing. You're just confused. Inability to wake or stay awake. You find yourself just drowsy, and it's like, oh, I can't stay awake, or I feel so tired. Normally, I'm not sleepy at 6 o'clock in the evening, but why am I so tired? How come I can't keep my eyes open? Those are signs that you probably need to see someone. And of course, the bluish lips or face, that means you're not getting enough oxygen because you're not breathing well. So these are emergency warning signs that you really need to seek emergency care for. So consequences of this virus, it's devastating consequences. I mean, this is a deadly virus, and it's constant. Our medical system and our medical conditions are already at its maximum, at its peak. But COVID-19, coupled with COVID-19, we're going to be in a world of hurt. Now, researchers have emphasized that older age, male sex, hypertension, diabetes, obesity, cardiovascular diseases are among the most important risk factors associated with the worst outcomes of this disease. And so but this does not say that because you're not an older person, well, you may be a 24-year-old male or a 32-year-old female. That does not say that you cannot get COVID-19. So people of color, this pandemic is having a disproportionate impact on people of color, especially African Americans. And the statistics are staggering to all it's just really staggering. Now, I will point out to you that there are worldwide, COVID-19, worldwide, we have had 34.7 million cases worldwide of COVID-19. Worldwide in deaths, we've had 1 million deaths worldwide. Now, of the worldwide folk that have gotten it, of the 34 million, 24 million have recovered, which is good. However, it is there. Now, we're going to break it down and bring it to the United States. The United States, 7.36 million folk have been infected with this coronavirus. And we've had over 209,000 deaths in the United States. It is a devastating disease. Now, the CDC has listed hospitalization and death rates by race and ethnicity. And as you can see by this chart, it breaks it down from people of color. You have the American Indians or Alaska Natives or non-Hispanic persons, Asian persons, Black persons, and you can see how it is impacting people of color. Now, as you go, you can see the cases, and I'm focusing on the African Americans. You have cases that are 2.6 times higher than the average American. Hospitalizations 4.7 times higher, and look at the death rate. Of all of the death rates, it's 2.1% higher, 2.1 times higher. And so if you see the numbers, absolutely devastating for the African American community, and you wonder why. Now, CDC, there are factors that increase our community spread and individual risk, and we're going to get into that. And there are also things that we can do to combat this. But you can, as you can tell from this chart, people of color are having a really hard. They're being hit really hard with this disease. The study by the Center of Infectious Disease Research Policy, they published this in July of this year, says that it is overwhelming that predominantly non-white communities bore nearly 3 times the bearer of this infection, especially in the poor neighborhoods. And once you start looking at the poor neighborhoods, as that last bullet says, even compared to non-whites and white poor neighborhoods, the non-white communities are 9 times greater than getting this COVID-19. So it is a devastating disease, absolutely devastating, and it's creating havoc throughout this country, and it's creating havoc throughout the world. So why is it so devastating? Well, as we already noted previously, there are pre-existing conditions that we have. There's that diabetes, the hypertension, the obesity. These things we are already hit. People of color already have these conditions, and they're a lot worse. But COVID-19 is making it even worse. Okay, and then it's so devastating as well because, yeah, we want to stay at home because we don't want to go anywhere. But however, people of color tend to be in these essential jobs that are not in the healthcare profession, including bus drivers and train operators and custodians. And everywhere you look around, you think, well, if it's so bad, how come people aren't staying home? Because they have jobs that are essential. They have jobs that has to keep the country moving. And as we're going to discuss later on, you will see that they have to go to work because these essentially go to work. A lot of times they're the only breadwinner, and so they don't have that option to stay at home. Okay, and then you have those structural inequities and social determinants of health that influence this, and then the implicit bias and the racial discrimination just all compounds COVID-19. So when we start looking at this, you ask, so it is so this is devastating. However, not only are we feeling paralyzed and gripped by this COVID-19, we have to deal with regular everyday life, okay? And life doesn't stop, and our taking care of ourselves doesn't stop because of COVID-19, although a lot of people are really afraid to go into their regular, to see their doctor for regular things, okay? So at the same time, we're still faced with economic challenges. COVID-19 is compounding that. We're stressed with regular sickness and death. We still have people dying from the flu. We still have people dying from hypertension. We still have people dying from stroke and heart attack and all these other ailments, cancer. But people are afraid to go in and get themselves checked out or seek the medical needs that they require because they're afraid. COVID is out there. I'm not going to. In my job as a primary care manager, you know, I talk to folk and I'm saying, how come you didn't get this addressed earlier? Well, you know, COVID is here and it's stopping everybody and I'm afraid. And I'm like, well, you know, you put this off, so you made your already medical condition even worse. And then you have the relationship issues that are compounded by this. You have COVID-19 is causing folk because we have to stay inside. We can't go out. We're sheltering in place. And so those relationships that were not so healthy in the first place have gotten worse. Divorce rates are high. Separations are high. You got problems with your kids. They can't go to school, so they can't have that regular interaction that they're having when they're doing their thing. So those tensions are mounting. And then parents are going to have to do teaching at home or home teach or help home teach or help with the computer. And a lot of parents aren't computer literate like the kids are. So it makes it really difficult to deal with. And then you have the mental illnesses and the caring of elderly parents and all of that. Just regular life is just compounding this. So the impact of people of color, these factors are causing COVID-19's the greatest impact. Limited access of care. I think that is probably one of the number one things that COVID-19 is definitely affecting. Access to care is already poor. It is horrible. However, we have to understand that, yes, COVID-19 is out there. Access to care is horrible, but we're going to have to find ways to get folk into the medical system to get their needs taken care of, especially their primary care needs, their preventative health care needs. And with that, lack of health insurance. A lot of folks don't have the health insurance, especially people of color. So we're already in a deficit because we don't have money to pay for medical things that we need to take care of, and we're uninsured. So if the first thing that someone would ask you is, do you have health insurance? And the answer is no. Well, we're sorry, we can't help you. So we need help with that and getting folk health insurance. The poor living conditions and environments. I shouldn't say most, but a lot of people of color live in areas that the living conditions are absolutely not ideal. Members of people of color may be more likely to, they live in dense populations. It's like you go into the inner cities, you go and people are stacked on one another, and that makes people living conditions just horrible. Research also suggests that racial residential segregation is a fundamental cause of health disparities. So racial segregation, folk who they like to be around their own, of course. However, because of where we live and the injustices that they're out there, it just makes the living conditions a lot worse. Okay, and then again, you got there's that burden of ill health. Those pre-existing conditions that we have, hypertension, diabetes, and those sorts of things, and the need to work. And I touched on this. I would love to stay at home and say, COVID is out there. I'm not going to go to work until things settle down, but I can't. I'm the breadwinner. I have to provide for my family. There are folk who want to stay at home, but they can't stay at home. And then the inability to practice social distancing because we live in dense populations. It's hard to practice social distancing. We have to get on. A lot of folk use public transportation. It's hard to say that, okay, well, is the city, let's take busing, for instance, the bus system. It's hard for the city to say, well, we're going to increase the number of buses that are on the street to allow for social distancing. That's not going to happen. Number one, the buses are limited. And number two, we're going to have, where we used to have 2 or 3 buses running this route, now we're going to increase it because we're trying to do social distancing. We're going to increase that to 6 or 7 buses. Will not happen, okay? And then the absence of privilege. What does that mean? I have health insurance, so I can go into the doctor or go into my provider and get taken care of. People of color, a lot of them don't have health insurance, so that privilege is gone. And so what are they going to do? The money-wise, I make money, but I wish I could pay $600 a month for health insurance, but that's not going to happen. I have 3 kids to take care of. And then there's that stigma and system inequalities. And what is that? Well, Johnny came down with COVID-19, so we're going to all stay away from him, okay? And so, or I don't want to tell someone that I got COVID-19 because I need this job, okay? And so you're not going to tell someone that if you're feeling sick, you're not going to tell anyone. You're going to keep it close to your breast, and you're going to say, hey, I hope like the world that no one finds out that or sees that, you know, I'm sweating or I look weak or I look frail. I'm just going to go and I'm going to keep pushing forward because I have to. So these are the things that COVID-19 are having this great impact on us. So again, just wreaking havoc on our already weak system. There's an access of care again. There's a systemic denial of resources and opportunities because some governments are freely giving and some governments are not freely giving, and they're not going to give you the money. They're not going to give you the resources that you need because of who you are, and therefore there you have it. And those barriers I've already talked about, those financial barriers, the geographic barriers, the transportation and physical barriers that are impacting us. So the impact is people with chronic diseases have these is incredibly wreaking havoc on the already critical screenings. Look, I can't stress enough. I tell my patients, you still need your primary care. You still need to be screened. You still need to get your vaccinations. You still need to take care of your medical needs. And they're just not going to do it because they are absolutely what it says, public fear of COVID-19. The fear is absolutely devastating us because people don't want to get it because the media and its things that it is sharing and scaring folk, okay? And then COVID-19 has shut down the economy. There are 1.4 million jobs that have lost this is just the healthcare sector, and doctors, private practices are closing down or scaling back because the revenue is not there to keep them open. In my practice at primary care, we have seen a 60% drop in seeing folk. Okay. Now, if you're working in a hospital, you say, oh, that's great, 60% drop, but it's not great because people are not taking care of themselves. So what can we do to mitigate the trend of COVID-19? Social distancing is probably the number one thing you can do. Stay away from folks, 6 feet away, okay? Use your the COVID-19 precautions, washing your hands throughout the day with warm water and soap, wearing a mask that covers your mouth and your nose. Again, practicing social distancing, disinfecting things, okay? Keep your hands from your face, all right? If you don't need to go out, please don't go out. If you start having symptoms, just call your provider and say, hey, I'm having these symptoms. Don't go into a place that you know that you could probably infect someone else or get infected because you are out there doing it. And we all know that there are more racial equity. We need more racial equity in medical education, okay? Get folk who are people of color into medical schools to help this out. Now, a lot of people, I can sit up and talk about it, but a lot of people like to see pictures to say, what can we do? So there's your social distancing. Stay at least 6 feet away from folk. Use the proper PPE, okay? Wear your mask that covers your mouth and your nose. And, you know, I go to church. We like to hug one another and show some love, but this is not the time to be hugging one another and showing some love. Avoid hugging and kissing and laying hands on folk and close contact. Okay. Wash your hands with soap and water. Use your antibacterial hand washing. Okay. Every chance you get, because you'll be amazed how many things you touch when you're out there in the world. So practice these things. Other ways, we need more minority representation in the healthcare profession. People of color like to go and see their provider and know that their provider is from their own cultural background. It gives you a sense of, oh, this is a sense of pride, a sense of, oh, this person understands me. So the healthcare profession needs to start bringing in people of color, healthcare providers of people of color. And you also, this is important, and this is something that our country, the United States, has failed miserably in, and that is communication. We have to be open and honest and transparent, and we have to be credible. It has to be, because if it's not, we're going to be in a world of hurt. We are in a world of hurt, okay? And from today's events, you know, the president of the United States now has COVID-19, is now hospitalized because they weren't open, they weren't transparent, they weren't credible. They were putting out things and trying to play things down. Don't do that. Over 200,000 lives have been lost now because of it. Now, will we start seeing things that what's going to change things? And then we have to prioritize our resources for clinics. We just can't be using our resources just all willy-nilly and you know, being wasteful. We have to make sure that we're using our resources very practically and efficiently. And then we have to cope with stress of this COVID-19. Recognize that, yes, it is important, it is dangerous, but we need to do the things that we need to do to keep ourselves safe and have great coping mechanisms. Stay away from the alcohol, stay away from the marijuana, okay? Stay away from becoming abusive and being angry. We have to love one another and take care of one another. And so what can we do? We can promote and encourage utilization of primary care. That is going to be important. We have to protect Medicaid, because Medicaid is one of those systems out there that assures that people of color get the medical care that they need. Medicaid is very important. We have to talk to our policymakers and our legislatures and senators and representatives and say, hey, listen, put more money into Medicaid. And then we have to require reporting of the COVID-19 surveillance by race and ethnicity. That is not being done, okay? And then we can start seeing and picking up what areas that we need to concentrate on in the country that needs more assistance. And then we need to promote community-based population initiatives, such as community-based population initiatives, and that will increase the cultural competence in provider settings, because a lot of the providers don't understand people of color. We have to increase their knowledge of that. Reduce regulatory barriers, use proven programs that reduce disparities and barriers to create opportunities for health. Work with other sectors. You have your faith and community organizations. That's the churches. We have community organizations out there that help folk with getting health insurance. Like in the Sacramento area, we have La Familia that is very helpful in getting folk health insurance. Businesses and transportation, housing. We have to create social and economic conditions that promote health starting in childhood. And then we also have to develop and provide training for healthcare providers to understand cultural differences. Again, understanding people of color will also help you, give you a greater understanding of what we need as a person of color, what we need in our lives to help keep us safe from hurt, harm, and danger. So again, you've seen this before, right? I cannot stress enough, practice social distancing. Please wash your hands with soap and water or antibacterial soaps. It's always nice to hug, but at this time, hey, give the head nod, give the elbow bump, or just from a distance, give a nice friendly hello, I appreciate you, nice seeing you, okay? And use your good personal protective equipment. I cannot stress enough, wear your mask that covers your mouth and your nose. Wear your mask that covers your mouth and your nose, because it is respiratory droplets that is gonna hurt you. Okay, and that is it.
Thank you so much, Dr. Ricky Norwood. Everyone, can we please give Dr. Norwood a round of applause?